At 36, Cinda leads a full life as a medical assistant and the mother of 3.
I go to work, and then after I get out of work, I come home, make dinner, either take Natalia to soccer practice or stay home and try and get ready for the next day. I would say 90% of the time is overwhelming, but at the end it's worth it.
As a central figure in the kids' lives, Cinda doesn't have time for health problems like heavy menstrual bleeding or HMB.
I use big, heavy pads, and yeah, my friends make fun of me all the time because they say I wear diapers instead of pads. But that's what I have to wear.
And there's no escaping the problem at night.
That I have to constantly get up because I can feel it. I have to run to the bathroom. I have to change constantly, and it's a big hassle.
Weekends and vacations can also be ruined if Cinda fails to plan properly.
It's kind of boring when you go to the beach and everyone's going in the water and you're just sitting there wishing you were home in bed.
Her doctor suggested endometrial ablation, a hysterectomy, or hormonal contraceptives, but Cinda didn't want surgery and she didn't need birth control. Then she learned about LYSTEDA tranexamic acid tablets, which are taken only during a woman's menstrual period, and got more information about HMB.
I read some literature on LYSTEDA and I started reading the symptoms. Once I started going down the list and I realized I would say all the symptoms, I said, this is for me. I have the heavy menstrual bleeding. I have to basically put my schedule around my menstrual bleeding, and I was willing to try it and I thought it was great. The flow was definitely a lot less than it usually was. And I think it's something that's important that patients do know that they have these problems and that they don't just have to deal with it. I would tell other women that have heavy menstrual periods that LYSTEDA works. I was recently able to go to Washington, D.C. for 5 days with my daughter and enjoyed every minute of it. I was able to do things that I would have never thought I would be able to do just because I was worried all the time of my having to change my pad constantly, and it was just something I would have never planned if I knew it was around that time of the month, and this time I wasn't worried about it. I mean, it's night and day, completely night and day. It was just wonderful.
LYSTEDA is a prescription medicine used to treat your heavy monthly period, menstruation, when your bleeding gets in the way of social, leisure, and physical activities. LYSTEDA does not contain any hormones and is taken only during your period. It does not treat premenstrual symptoms, does not affect your fertility, and cannot be used as birth control. It does not protect against sexually transmitted diseases. LYSTEDA has not been studied in adolescents younger than 18 years of age. You should not take LYSTEDA if you currently have or have ever had a blood clot, have been told you're at risk for having a blood clot, or are allergic to LYSTEDA or tranexamic acid. LYSTEDA can cause serious side effects, including the risk of serious blood clots may be increased when LYSTEDA is taken with hormonal contraceptives, especially if you're taking higher than your normal dose of birth control, are overweight, or if you smoke cigarettes. Risk of serious blood clots may also be increased if you take LYSTEDA with medicines used to help your blood clot, or some medicines used to treat leukemia. Be sure to tell your healthcare provider if you take any of these medicines. Stop taking LYSTEDA if you experience any eye changes, and promptly report any eye problems to your healthcare provider. If you have an allergic reaction, have shortness of breath, and your throat feels tight, stop taking LYSTEDA and get medical help right away. The most common side effects of LYSTEDA include headaches, sinus and nasal problems, back pain, pain in your abdomen, pain in your muscles or joints, anemia, and fatigue. If you notice a change in your usual bleeding pattern that worries you, or your heavy bleeding continues, contact your healthcare provider right away. This may be a sign of a more serious condition. You're encouraged to report side effects of prescription drugs. Contact Ferring at 1-888-FERRING or call 1-800-FDA-1088 or visit fda.gov/medwatch. Please see full prescribing information for LYSTEDA.